When I came into the Gaza Strip, I was prevented everything except for one suitcase, and I've been here for a month. And so as much as I tried to stuff within that suitcase, there's only so much you could put in one suitcase, and we have 10 patients here that would use all those medications probably in a day or two. While the healthcare workers here save lives and do their best to keep people living, they are thinking about their own family members at home, and when they hear the explosion in the distance, which we hear every hour or two while we're here in the buzzing above us of the drones, those healthcare workers are constantly in two worlds. One where they're here with their patient, where they know they have a duty by the career that they've chosen, and the second is to their own family and their own neighborhoods at home, where they don't know when the next patient that rolls in will be their family member. The medications we use for controlling severe bleeding, especially in patients with liver disease, in an environment where everybody is bleeding, we are out of these really vital medications. And so what the communities had to do is work off of suitcases bought in by prior medical teams greater than 3 months ago, because currently all inflow of medical supplies has been stopped at the border. We have several cases in the last 24 hours where they survived their surgery. They survived the initial blast, they survived the initial resuscitation, but then subsequently passed from infection related to the lack of wound care supplies and typical supplies we'd see in any hospital in the world. This is a 20-year-old woman who suffered significant traumatic brain injury. She may be able to be pulled off the ventilator, she may breathe for herself. Whether or not she'll ever talk again or wake up again meaningfully or walk again is truly an unknown thing for us. She's a 5-year-old little girl who came in overnight. The blast and this injury is not the end of her journey to recovery, right? She has the physical recovery ahead of her of recovering from low oxygen levels and lung injury and superficial burns and these type of things. But in the long term, the thing that I feel most concerned about for the population as a whole and from a public health perspective is these kids have seen and experienced things that kids are not supposed to experience.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.